I will explain the two prioritized nursing care plans for Mr. B. Our first nursing diagnosis is unstable blood glucose level, which is hyperglycemia, related to the lack of adherence to diabetes management, as evidenced by having a random blood sugar level at 16.6 millimole per liter. Our nursing goal is that the patient will maintain a normal fasting blood glucose level at 4 millimole per liter to 6 millimole per liter, and the post-meal blood glucose level of less than 8 millimole per liter throughout the hospitalization. The first nursing intervention is to monitor the patient's blood glucose level hourly to detect any abnormalities so that immediate corrections can be done. Next, educate the patients about balancing food intake with physical activities. This is important in prevent a sudden increase in blood glucose level. Next, advise the patients to cut down on daily carbohydrate intake because high blood glucose level is usually greatly depends on high consumption of carbohydrates. This should be controlled closely in stabilizing the high blood glucose level. Next, we can administer medication as prescribed, following the 7 rights, such as metformin and gliclazide, to increase the insulin sensitivity to bring down the blood glucose level. The last nursing intervention is to educate the patient on how to check his own blood glucose level by using a glucometer to detect any signs of hypoglycemia or hyperglycemia for immediate medical interventions to be done. Our nursing evaluation is that the patient maintains a normal fasting blood glucose level at 4 millimole per liter to 6 millimole per liter and a post-meal blood glucose level less than 8 millimole per liter throughout the hospitalization. The second nursing diagnosis is imbalanced nutrition, less than body requirements, related to reduced oral intake as evidenced by patient verbalize of reduced appetite with difficulty in swallowing, feeling nauseous, and loss of 7 kg over the months. The nursing goal is that the patient will show an increase in appetite and nutritional ingestion sufficient to meet metabolic needs at a stable weight which is within 10% of the ideal body weight during the hospitalization. First, assess the patient's in difficulty of swallowing. Report to the doctors immediately if the patient is presented with drooling of saliva and having the difficulty in swallowing his own saliva. Next, encourage the patient to take small amounts of food frequently. This is to meet the nutrition needs and also prevent the patients from feeling nauseous due to fullness. Next, discourage caffeinated or carbonated beverages as these beverages will decrease hunger and lead to early satiety. Also, encourage the patient to perform oral hygiene before the meal to remove unpleasant taste and increase his appetite. The next nursing intervention is to administer medication prescribed such as vitamin B complex based on the 7 rights. Vitamin B complex is prescribed to promote cell health, energy level, good digestion, and a healthy appetite. Also, encourage the patient to exercise because physical activities can help to improve metabolism and absorption of nutrients. Last, report immediately to the doctor if the patient is still having difficulty in swallowing for an alternative method such as NG feeding to ensure the patient receives adequate nutrition and calories. The nursing evaluation is that the patient shows an increase in his appetite and show a nutritional ingestion sufficient that meets his metabolic needs and also a stable weight which is in between 10% of ideal body weight during the hospitalization. The other nursing diagnosis includes altered family process related to the illness of the head of the family member, as evidenced by the inability to perform the role of breadwinner of the family. The next nursing diagnosis is the risk of decreased cardiac output related to the inadequate blood pump by the heart to meet the body metabolic demands. And lastly, the risk of infection related to the side effects of chemotherapy.